Our Dean for the School of Education, and Professor Paul Catt, the Program Director of DBA, but also he serves in our department. So I welcome everybody, those who are online and here. So what we usually do before we start the presentation or the defense, the committee have to step out and deliberate, or rather decide how they want to proceed with the meeting, and then we'll come back and then we'll invite you to proceed. So I kindly ask the committee to step out, and we'll be back in a few minutes. If you want, Anthony, meanwhile you can chat with your people online.
Yeah.
Here.
You have the people online. You're welcome, don't worry.
No. Back, and the committee has decided we proceed with this presentation. So as you present your dissertation, in between we may interrupt you for some questions and clarification. Otherwise, the stage is yours.
All right, thanks. Thanks everybody. Thanks to my committee, thanks to my chair, thanks to everybody for coming, those who are watching live, and thanks to my beautiful wife, Precious, for all her support. So today, my dissertation is African American adults with type 2 diabetes and self-management education. It's a phenomenological study in the Twin Cities of Minnesota. This is not moving like the team.
Let me see.
Smile for the camera, Dr. David.
There you go. All right. Okay, so the agenda for today, we have an introduction, overview, research question, delimitation and limitation, philosophical assumptions, significance of the study, rationale of the study. We have key definitions, literature review with key points, research gap, methodology, ethical considerations, data analysis. Then we move on to findings. We also look at the demographics, we talk about the teams, and from the teams we talk about some quotes from the participants, just to bring you the voices of the participants, essence of the study, limitations of the study. Then we move on to discussion, recommendations for future research, conclusion, acknowledgements, and gratitude. So this is the agenda for today. My name is Anthony F. Swaray. I'm originally from Liberia, West Africa. I'm married. My beautiful wife is here, Precious. We are blessed with 4 kids. We have 1 girl, 3 boys. Educational background. I have a bachelor's degree in accounting from the University of Liberia with a minor in economics. Master of Science in Project Management and Master of Science in Business Administration from Swaray University of Minnesota, and then Master of Science in Health Informatics from the College of St. Scholastica. Let's go into the overview of the study. According to the research, more than 37 million Americans have diabetes, and it says 1 in 10. And all of that number, you see that at least 90 to 95% of people with diabetes have type 2 diabetes. And also in 2014, they said there was an increase, 9% increase in the prevalence of diabetes, according to Collins and Hall. By 2030, It was also predicted that there will be at least 350 million people will be affected with diabetes. And the three types of diabetes are type 1, type 2, and gestational diabetes.
Just, Anthony, just to be clear, that second bullet point,
Yeah.
90 to 95% of Americans have
Type 2 diabetes.
That's of the total population?
Yes, that's based on the 37 million.
Oh, of the 37
Yeah.
million?
Yeah,
Oh,
according to that research.
okay.
Yeah. The research question for this study is what are the life experiences of African American adults with type 2 diabetes and self-managed medication in the Twin Cities of Minnesota? Delimitations. Delimitations are defined as the limits and boundaries set by the researcher. This is where the researcher have control over in the research. So for this dissertation, the population is the African American adults with type 2 diabetes. And then for the location, where are they? Where are doing the research? In the Twin Cities of Minnesota. So that's the scope of the research. Limitations are the potential weaknesses. These are factors that the researcher has no control over. Limiting the research to African American adults in the Twin Cities will create data that is not generalizable. That was one of the limitations, because we are only dealing with certain number of people within the population. There was no control over a participant who wanted to withdraw from the research. I didn't have any control over that person. The study did not include African American adults with type 1 diabetes. And in every research, there are assumptions. These are the philosophical assumptions. We have 4 assumptions that were brought into this research. The ontological assumption, this one has to do with the nature of reality. And it deals with what is true or not true. Based on this assumption, it is assumed that the researcher anticipates an outcome with multiple realities with all responses to the research question. That's the ontological assumptions. And the epistemological assumption has to do with the nature of knowledge. So conducting this research, what knowledge are people going to gain from this research? Diabetes patients, healthcare professionals, and policy makers. So with the epistemological assumption, it is assumed that people are going to gain knowledge from this research. And then the axiological assumption, it talks about the nature of value of the researcher. So I, Anthony Swaray, conducting this research, I have to bracket myself from the research to bring integrity to the research because of my personal biases. I am diabetic. I'm type 2. So I have to bracket myself during this research so as to bring integrity to the research. And then the methodological support, assumption, is an assumption that has to do with the role and the methods and approaches of the research. So for this research, what approach are we using? It's the phenomenological approach. It's assumed that because we are investigating the lived experiences of African American adults with type 2 diabetes in the Twin Cities of Minnesota. And we are using a semi-structured interview guide questions. It brings us to the significance of the study. What is the significance of the study? This research is going to contribute to knowledge of who? Diabetes patients, healthcare professionals, as well as policy makers and other people in academia. The rationale of this research brings us to diabetes is described as a chronic metabolic disease. Yes, but it's prevalent among African American adults in the Twin Cities. Now, many scholars have conducted research, but there hasn't been enough information with respect to the non-adherence behavior of African Americans with type 2 diabetes. As you can see, when compared to Hispanic, non-Hispanic whites, African Americans are 25% less likely to adhere to doctor instructions. This study was conducted to get answers to those non-adherent behavior that we see for African American adults. The result of this study will also enhance knowledge of people in academia and participants, as well as other people in government. So for diabetes, there are key definitions from the literature. We have diabetes complications. What are diabetes complications? They are complications, they are conditions that result as a result of poor management of diabetes. So people who do not manage their diabetes allow their blood sugar to run very high continuously, they run into diabetes complications. And there are different types of diabetes complications that you will see further down in the presentation. Diabetes self-management is the second one. According to the literature, it's a program that has been put together by healthcare professionals to be able to empower people with diabetes, type 2 diabetes, to manage their diabetes effectively. So they attend diabetes education sections at the clinic or wherever it is being held. Type 1 diabetes is a diabetes where the body cannot make insulin. It is also known as insulin-dependent diabetes, juvenile diabetes, or brittle diabetes. And also we have gestational diabetes. It's a condition that affects people when you are pregnant and their blood sugar keeps running very high. Type 2 diabetes is a diabetes that is caused by high blood glucose, high glucose in the blood. So with type 2 diabetes, people are placed on medications so as to be able to help them. They have to make some lifestyle modifications to be able to control their blood sugar. And then we have hypoglycemia and hypoglycemia. Hypoglycemia with the O, PO, is the one that is a very low blood sugar. When the blood sugar runs below 70, then it's a problem. And hypoglycemia is the one that runs very high. Early in the morning, while fasting, if your blood sugar is above 125, you are in a hypoglycemia stage. When your blood sugar runs 180 after eating, 2 hours after eating, you are still in a hypoglycemia stage and you have to take action.
You know, is it fair to say, too, in reading your dissertation, that those that have type 2 diabetes also are considered to be hyperglycemic?
Type 2
Are they exclusive? So those that have type 2 diabetes, do they also have hyperglycemia?
Yeah,
Nature, right?
yes. Because if you are not exercising, let's say late night you ate, you went to bed, your blood sugar is going to be high throughout the night. If you woke up in the morning, sometimes it's going to be 300, 200. Yes, so you still have, even with type 2 diabetes, even though you are insulin dependent like type 1, but with type 2 diabetes, you have to make some lifestyle modifications. You have to exercise, take your medications to get your blood sugar at the normal level. So with the literature views, there are some key points, especially when it comes to diagnosing people with diabetes. So we have A1C, is where the patients have an average blood sugar tested for the past 3 months, and to determine whether the patient is diabetic or not. And they have the numbers from 5.7 to 6.4. So when it's 5.7, below 5.7, it means that you are normal. From 5.7 to 6.4, it means you are pre-diabetic, and then anything above that, you are diabetic. And this test is run every 3 months. Fasting plasma glucose test is used to check the patient fasting blood sugar after 8 hours. So you have to fast for 8 hours. And the numbers runs from 100 to 125. So from below 100, you are normal. From 100 to 125, pre-diabetes, and from 126 up, you are diabetic. So that's for the fasting plasma glucose test. And then they also have the oral glucose tolerance test. This one is conducted before and after you drink, a patient drinks a glucose liquid. And after drinking the liquid, then they wait for like 3 hours, and then the test runs from 140 to 199. Less than 140, you are normal. From 140 to 199, pre-diabetes, and then above that, you are diabetic. The random or casual plasma glucose test is a test that is run anytime. And this test, doctors run the test when the patient has severe diabetic symptoms. So sometimes the patient is urinating very fast, is drinking a lot of water, the patient is having headache, the patient is restless, fatigue, all those symptoms. Once you have those extreme symptoms, this test is run. And anything above 200, you are diabetic. Diabetes complications. These are some of the complications from diabetes. So we have diabetic neuropathy, diabetes retinopathy, diabetic nephropathy, erectile dysfunction, periodontal and cardiovascular disease. These are some of the complications that are from the literature that if your blood sugar is not managed properly, you are going to have. So for diabetic neuropathy, it has to do with nerve problem. That's when the patients start to have tingling in their fingers, their toes, their body pains, and it can be very uncomfortable and painful. Diabetic retinopathy has to do with the eyes. So your retina is damaged, and you have to go and see your eye doctor regularly. Diabetic nephropathy is also known as chronic kidney disease. That's when you start having problems with your kidneys. That's why it's advisable to take care of your diabetes, because if your numbers continue to run high, it's going to affect your kidneys too. Erectile dysfunction is the inability for a man to maintain erection during intercourse. So as a diabetic, you have to make sure that your blood sugar is normal throughout. If your blood sugar is not normal, as a male, you're going to have erectile dysfunction. Periodontal disease, that has to do with the gums. It damages the gums. As diabetic, you have to see your doctor all the time, your dentist. So people who do not manage their diabetes, they start to have gum disease, bad breath, and other things that affect their oral health. And then cardiovascular diseases comes as a result of poor management of diabetes, because you develop cholesterol, and then with the blood is not being able to pump through the body, and then you start having high blood pressure, and and then runs into stroke. So stress and diabetes, they are both psychological and physical stress are factors, according to the literature, that are directly linked to diabetes. So whenever your stress is high, according to the research, your blood sugar is high. So that's why patients who work with diabetes educators have to go through their diabetes education to teach them how to manage stress. You have to learn it, so that when you are stressed out, you have to know how to cool down and take some necessary steps so that the blood sugar can be under control. And we have diabetes self-management education, a program that teaches patients to effectively self-manage their diabetes. Before, according to the literature, diabetes self-management education, you attend the classes, but afterwards you have to come home, and you need a support network. So you have to be able to manage diabetes while at home or while you are out there with other people in the community. There are benefits of diabetes self-management education. And what are those benefits? According to the literature, you have lower A1C. And you saw the A1C numbers that runs from 5.7 to 6.4. Right between there. if your A1C, if you are managing your blood sugar the way you should, then it's going to reduce your A1C. Prevent life-threatening complications. There are lots of complications associated with diabetes. So if you attend diabetes self-management education classes, according to the literature, you will be able to prevent complications. And then hospital admissions. People who do not manage their diabetes find themselves in the hospital more often. You have to see your endocrinologist, you have to see your primary doctor all the times. But if you are managing it, according to the literature, you won't have to be in the hospital regularly. And there are some medications that are from the literature. We have metformin, glitazone, sulfonylurea, Novolog, Himalon, Levemir, Lantus, Fitosa, and Ozempic. These are some medications that doctors prescribe to help patients to manage their diabetes. And like I said earlier, there are symptoms of diabetes. That when we talk about the random casual test, these are some symptoms. Frequent urination, feeling thirsty, you drink it more often, increased hunger, fatigue, blurred vision. These are some of the symptoms that when you have, doctors will have to run such a test on you. The research gap. Because of the lack of sufficient information, this research was conducted to fill in the gaps due to the non-adherence behavior of African Americans with type 2 diabetes, and also to find an effective treatment plan for African Americans.
While you are there, can you explain to the audience that your study was not scientific,
Yeah.
but educational?
Yeah. Okay. So this study, one may ask, like what Dr. Machia just asked, why is that scientific but educational? Yes, this study is educational because it has to do with diabetes self-management and education. All right. There is also another theory that I brought into the dissertation that has to do with the andragogy. Andragogy by now states that when you have adults, you are dealing with adults, and this study is about adults. You are dealing with adults, adults must be motivated, okay, to learn. So in self-management class, they have to learn. Adults must be in a conducive environment, and they must have interest in learning something before they can be willing to participate. So if they are not interested in it, they are not going to learn it. So this study is about diabetes self-management education because it's directly aligned to the principles of andragogy as stated by notes.
Okay, thank you.
Oh, Anthony,
Yeah.
before you jump into methodology, because your research literature review was fascinating. I have a few more questions, so bear with me.
Okay.
So, when it comes to type 2 diabetes,
Yeah.
because that's who your group was, your sample in your population, could it actually be reversed in an individual? Type 2, once you're diagnosed. Type 1, what I've understood, you can't.
You can.
But type 2, is there like a way to make those symptoms go away?
Where I didn't see where it says that it will be reversed in the literature, but making lifestyle modification can improve your quality of life. Yes. So if you exercise regularly in accordance with what doctors want, because as a diabetic, you cannot exercise like the people who do not have diabetes. You have certain limits.
Yes.
Yeah. So you have to make some lifestyle modifications, and that will improve your diabetes. The literature did not tell me whether it can be reversed, but you can improve your diabetes and live a comfortable life and prevent life-threatening complications.
Thank you. And my next question was, you're focusing on African Americans, in this case in the Twin Cities.
Yeah.
Right, which I know you'll get into. Did you find in the literature that there is a difference between those African Americans, of course, that are in the 48, 50 states of the US versus Africans in their diabetes type 2. So what I mean is like, all right, did the research indicate that in the United States, maybe due to our diets and what have you, that African Americans are more susceptible to it because of the culture they're in, that is in the US, versus like if you're in Africa or Guyana or what have you?
Well, according to the literature, there's something that talk about diabetes outside the United States. It's also talking about Canada. In Canada, the African black people are more susceptible to diabetes too. Even in England, there was a study done, and that it was 9.2% of the study percent, yes, that black people were more susceptible to getting diabetes than compared to Caucasians and others. Yeah, but within the United States, it has to do with different factors. Yeah, social economic factors could be some of the factors responsible for the lifestyle and the food and the culture, and those are some of the things that are responsible for the prevalence of diabetes in the African American community, according to the literature.
Yeah, that's helpful. And could you go back one slide? Sorry.
Yeah.
Or one more. So yeah, it's the diabetic medications.
Yeah.
Right? When I read through your work, it's very timely because what you see on commercials now, the ones I'm not familiar with all the medications, but I know of Ozempic, Victoza, and Metformin. Right?
Yeah.
And Ozempic has come up into the spotlight.
Yes.
Right?
Yeah.
They are associating, maybe, I don't know if this came up in your literature, but they're associating Ozempic with reducing diabetes, possibly helping with depression, but in addition for weight loss as a side effect. Did your literature, you talk at all about type 2 diabetes and those with certain weight levels, or was that not a non-issue?
Yes, in my paper, okay, for Ozempic, there was not much information on Ozempic with respect to weight loss.
Yeah.
That was not in the literature, but in my paper, in the literature, we talk about the modifiable and non-modifiable risk factors.
Yeah.
So the modifiable risk factors are factors that can be changed, that can be altered. So you have cholesterol, blood pressure, and you have weight. You can, your weight is factored into it. So if you go through some exercises and you want to get your weight down, it's going to help with controlling your diabetes. But if you gain more weight, it's problematic. According to, that's why they say modifiable risk factors that can be changed due to a patient with diabetes.
Appreciate that. Thanks for.
And so, is some, and I should remember this, but I don't, is there some portion of this that's genetic?
Well, on the non-modifiable risk factors, they talk about ethnicity, they talk about race, age. Yeah, those are things based on culture, based on your race. Yeah.
So obviously genetic things are not things you can modify. But what percentage of contributing factors are things that are under your control, and what percentage are things that you don't have control over?
Those that you don't have control will be your ethnicity, your race. You don't have control of that. So it is just part of it. And your age. So for type 2 diabetes, you are in your late adulthood, and you start to develop it because you are not active like before. Yeah. So that's what it stands.
Okay, thanks.
Yep. Okay, so methodology is chapter 3, and one of the most interesting part of the research. So we talk about the research design. So this study is phenomenological study, and phenomenological study has to do with the study of the life experiences of the participants is it does not only study the events, but it also focuses on the historical, political, and social context of the study of the participants. And on our phenomenology, we have two, the transcendental and the hermeneutic. The transcendental deals with the unbiased description of the participants in the study. This is where the researcher does not make any interpretation about the study. But the hermeneutic is where the researchers interpret the findings of the study. So, and we also have face-to-face interview with probing questions. And this research is about the hermeneutic approach and not the transcendental, because the researcher, I as the researcher, will be interpreting the life experiences of the participants. Population, we have 12 people that were interviewed. 5 females and 7 males. For the sampling methods, we have purposive sampling and snowball sampling. One may ask why I have snowball sampling. But first and foremost, 12 participants were interviewed using the purposive sampling method. The purposive sampling method, so I was able to get all my participants on the purposive sampling method. And the purposive sampling method is a non-probability sampling method that allows the researcher to be able to recruit participants with similar characteristics. But the snowball sampling is also a non-probability sampling method, but it's a random sampling method. This one is executed when your participants are very hard to reach. You can't get them easily, so you resort to snowball sampling. But all my participants were recruited based on the purposive sampling. So the snowball sampling was just here as a backup, just in case I couldn't get my participants, then I would have to default to that. Validity. Validity is the degree to which an instrument measures what it's supposed to measure. So during the research, I use 3 methods. We have member checking, where you interview the participants and then the transcripts are sent to the participants so that you can be able to verify that yes, or validate that the information you have on my transcript is exactly what I said, because you do not want to skew the interpretation of the results by putting in something that is not acceptable. So transcripts were sent out for validation, peer review, the use of the second caller to establish credibility was used. And my second caller is watching live, Dr. Adu. Thank you so much. Yeah. And then clarifying the researcher bias. Like I said, the process of bracketing was used. Since I'm diabetic, type 2, I had to bracket myself from the research and go according with the findings of the participant, whatever the participant said, and do not bring my personal emotions into this. So for reliability, reliability is enhanced by taking field notes, and transcribing audio recording. But to enhance reliability here, the strategy of consistency was used. This is where you have consistent administration of the instrument across all study participants. So what was done with participant 1 was done with participant 2 until you get to participant 12.
One thing.
Yeah.
So you're in your sample that you have of 12 participants. Thank you for having a nice distribution among the genders. That was awesome to see. My question goes back to something earlier, and it's the idea in the recruitment process, because I read your work through. Of the 12 people, one of the criteria is they have to have type 2 diabetes.
Yeah.
What else? Was there, I mean, you could ask the gender, or was that it? So they basically have said, no, I have been diagnosed with type 2 diabetes. Was that the only criteria? for participants?
And you have to be 18 and above.
18 and above.
Yeah.
And within Twin Cities.
And then will be the Twin
Twin
Cities.
Cities.
Yes.
Okay.
So 18 above, then will be the Twin Cities and type 2 diabetes.
Africa.
Other than that, you are
And
outside the
and
bracket.
African.
Yes, I remember.
Thank you.
All right. And so after collecting data and everything, it brings us to the data analysis process. And I decided to do this way so that it can give you a clear picture of what the process was. So the first thing was recruiting the participants after going through the institutional review board, and then conduct interviews. And then from conducting interviews, you have to convert the audio recordings to transcripts, and then edit the transcripts and send to participants for members checking. And when we say editing transcripts, you want to read the transcript and make sure that things that don't sound right are not in the transcript. Yeah, but even if a participant home, you have to leave that in the transcript because it is what they are saying. Upload the edited transcripts and demographics to the InVivo software. InVivo is a data analysis software. I love it so much that I use to be able to upload my transcript and the demographic information. Researcher and second quarter created codes from the transcripts in InVivo, and we met at least 4 times. Then we have the cluster the codes, where you go in Microsoft Word and create your clustering bars, import the different codes, and then come up with the teams. And all of that, 6 teams emerge from this process. Okay, every research has to go through ethical considerations. This is very important. During this research, the participant receive and they sign the consent forms, and then after acknowledging the understanding of the purpose of the nature of the study. So you explain the study to them, explain what the study is all about, and you give them the consent form and they sign it. And then you also have to ensure them that yes, indeed, confidentiality is going to be high on the agenda because we are doing this in accordance with the rules from the institution that we work with, the institutional review boards, the mirrors, to protect the identity of people. So participants, we use pseudonyms to be able to conceal the identity of the participants. So if somebody was Paul, in the after the interview, that person might be Mike or something else. So that's what pseudonyms we have. These are the 6 things that emerged from the study. African American adults with type 2 diabetes experience complications that weaken their day-to-day activities or their daily activities. African American adults with type 2 diabetes also acknowledge effective strategies for managing their type 2 diabetes. Participant adherence to providers advice determines the effective management of their type 2 diabetes. Participants also learn the warning signs of their blood sugar from their day-to-day experience, and managing type 2 diabetes was influenced by accessibility to insurance and medications. And then the last one was diabetes education, enhance the self-management skills self-management skills and knowledge of people with type of the participants and their condition. So this is the demographics we have here. As you can see, we have participants. We have participants pseudonym right here. So these are the names that was assigned to the participants that were interviewed. And we have the gender, the age group, educational level, and designations. As you can see, we have from associate degrees to master's degree, and we have different designations here, human resource managers, etc., with social work and people in different categories of job line. The findings of the research. So I decided to do it this way so that we can have team 1 this way, team 2, and we can be able to fit it up. So African Americans experience complications that weaken their daily activities. So what are some of those things that weaken their daily activities? One could be causes eye problems, diabetic retinopathy. When you have diabetes retinopathy, your eyes are giving you problems. You cannot do what you're supposed to do. It's going to bother you. Yeah, and then pain in fingers, legs, and other parts of the body. That's diabetic neuropathy. That's pain, severe pain. And then because of that, people are able to work because of the nerve pains. So these are some of the effects from diabetes due to poor control of diabetes that weaken participants' ability to do their normal thing. African American adults with type 2 diabetes acknowledge effective strategies to manage their type 2 diabetes. What are some of those strategies? Counting carbohydrates. Counting carbohydrates is a process where people with diabetes go to the store, they pick up the food, and they look at the packaging of it, and you have to look at the carbohydrate on it and know how much the carbohydrate is. Like if the carbohydrate is 50 grams, and you are looking for 15 grams, you definitely default to the one that's 15 grams so that you can have something with high carbohydrate content. Eating in portions. Eating in portions is eating by piecemeal. You know, you don't sit in one sitting and eat maybe a whole plate of rice. Okay, a whole bowl of rice, like maybe you went to the Chinese buffet and you sit there and you just eat a whole bowl of rice, or you eat, you know. So eating in portions is something that you learn from the diabetes education class so that you can be able to eat bit by bit so that your blood sugar cannot increase. Staying away from sugary food and drink. People with diabetes learn from diabetes education sessions or classes that they have to stay away from sugary food and drinks. You go to the store and you see a pop with 64 grams of sugar, and you want to buy that. But diabetics will have to look for something that says sugar-free drink or something with just natural sugar. Okay, depending on the kind of medication you take, you have to decide on what you want to put in, because when you put it in, it takes time for it to get down. Yeah. And then exercise regularly. Exercise regularly is one thing that we found out from participants that they need to exercise. If you exercise, whether you walk, whether you run, it's going to help with your blood sugar. Okay? And there were some participants who said that on their job, even though they don't have the time to exercise when they get home, but they do a lot of walking on the job. So walking helps them with their blood sugar too.
Do we have voices of the participants?
Yes.
Okay.
Yes, after this section,
Okay.
yeah. Participants' level of adherence to providers' advice determine effective management of diabetes. So this section is just about following doctor's instructions and keeping up with regular appointments. So there were participants who emphasized that you need to take your appointments seriously. You have to go to your appointments regularly, because if you go to the appointment, the one participant said it's going to be like a puzzle where you and your doctor will sit together and try different things so that you can be able to get to your target numbers. Because with diabetes, it's always about target. The doctor say, okay, our goal is to get to 120, or want your A1C to be 7 or 6.9. You have to work towards that goal. And then keeping up with regular appointments. You have to go to your appointments, and you have to take your medication on time. You have to follow the regimen for the medications. And if your doctor wants you to exercise 3 times a week, you have to exercise. So following doctor's instructions was one of those things that participants really stress on. Team 4, participants learn the warning signs of their blood sugar from their day-to-day experience. So what are some of the symptoms of hypoglycemia and low blood sugar? As you can see here, if you are diabetic, according to the participants, some of them feel dizzy, they have headaches, blurred vision, and they field tested, and then frequent urination. Like they run to the bathroom, like we're sitting here, somebody will go to the bathroom 3-4 times because his blood sugar is high. He has to go in and pee and comes back, and then he drink more water and go and pee and come back, and he's just thirsty all the time. And then for low blood sugar, you start sweating, you feel shaky, you feel anxious, nervous, and you have mood changes, and you also have blurred vision. So the symptoms are very obvious, and across the participants, they all mention similar things like that. Managing type 2 diabetes was influenced by accessibility to health insurance and medications. So according to the participants, health insurance is very important, because if you don't have health insurance, it's going to be very difficult for you to manage your diabetes, because it is through health insurance that you get medications and go to diabetes education class. You won't be able to go to diabetes education class if you do not have insurance. So that's what this theme was about. Diabetes education enhances self-management skills and knowledge of participating condition. So after attending diabetes education classes, the participants said that most of them were able to learn to manage their blood sugar. Some of them learned to manage their blood sugar regularly, monitoring it, checking their meters, or whether they are on insulin pump. But no matter what other regimen you are on, you are able to manage your blood sugar and know whether it's high or not. Whether your blood sugar is in the normal range or not, but they are aware that it is high or it's low. They understand their A1C numbers. Every diabetic or the participants talk about the A1C numbers. And their A1C numbers run from 5.7 to 6.4. And according to the Center for Disease Control and Prevention, they want your A1C number to be at a specific level. And you have to work towards that. They learn to be self-disciplined. Self-discipline is one of the things some of the participants talk about. You have to be focused. You have to be mindful of what you eat. Even when you are out there attending a wedding, you have to be disciplined. You have to be self-conscious that indeed, that my diabetes, I can't eat this, I can't eat that. Even though it is tempting, but you have to control your cravings. Knowing when to exercise and eating in portions were also two other things that participants emphasize about. Now, here are some of the quotes from the participants. Honor Team 1. Paul narrated, if your sugar level continues to run too high, it will lead to amputation and depression. If you do not manage your diabetes, it will affect your liver and kidney. It is very important to manage your sugar level. That's Paul. And then Patricia said, I take atorvastatin for my high cholesterol because it has been running high for a very long time. It is because of my high numbers that my doctors put me on atorvastatin. Patrick said my cholesterol used to be so high, but after my recent visit with my primary care provider, the laboratory result proves that my cholesterol poses no risk for heart attack or stroke. And then Jerry said, the doctor is concerned about my eyes. So every year I check my eyes. I'm going to go this year to check my eyes. Also, I use glasses but just for reading. And then on team 2, when they talk about the effective strategies, Julius mentioned, I went through a diabetes education class and they told me how much carbohydrates I'm supposed to eat when I eat rice, bread, and stuff like that. Rena stated, where I learned how to control carbohydrates, eat less carbohydrate, eat more protein, and exercise. So as you can see, most of the participants are still focusing on those things that they learned from diabetes education class, and they are emphasizing them. Paul said, so what I learned from my diabetes class is that you can eat rice. I used to eat 3 scoops of rice. Now what I do is I take 1.5 scoops of rice and add a lot of vegetables to the plate. And then Watson explained, yes, like I said, to manage diabetes is to be able to stop late eating, watch the diet, cut down on too many carbohydrates, and then exercise. And Antoinette said, I have stayed away from soda and other fruit juices because if I drink the juice excessively, the next day I will experience a yeast infection, and that can be very irritating, and if you are not careful. So honor the participants' adherence to providers' advice. Cole explained, I'm following all necessary precautions so I don't get to the stage or to that level of diabetes complications. I'm doing everything necessary that needs to be done. I tried one thing again, they advised me about was alcohol, which of course I don't drink alcohol anymore. My healthcare provider told me that it is not good to drink alcohol when you have diabetes. I try to drink much water and watch my diet. And then for Timothy, he said, so I frequently go for hospital visits and I do not overlook any of my symptoms. If I got a headache this morning and took Tylenol or some pain medication and it is persistent, I will go in. I will go to the urgent care or something. So participants learn the warning signs of their blood sugar. Trayvon said, for me, when my blood sugar is high, I feel dizzy. My hair starts swinging. When my blood sugar is high, I also feel weak, tired, and I get joint pains. Laura added, when you are stressed, your sugar goes up. When my blood sugar is high, my neck becomes tight. I start feeling thirsty, and then I start drinking a lot of water. Paul explained, now if I start to feel that I am very heavy and sweaty, I know that my blood sugar is going up. If my sugar level goes up, then I try to take a walk, and if it stays like that, then I take maybe 4 to 5 units of insulin to bring it down. And Antoinette also stated, when my blood sugar is extremely high, it's not good. My mouth foams like somebody put an oily soap or liquid soap in the top like a jacuzzi. All right. And then thing 5. This one has to do with the influence by accessibility to insurance. Wyson said, I have insurance, but the cost is too high. Well, there is nothing more expensive than health. Trayvon explained, I have insurance through Northpoint where I get my care. My insurance is good. I have not experienced any problem because my insurance is clearly stated on my card. It says zero copay. Cole Allen, well, that's Blue Cross Blue Shield. Sometimes it's a little challenging because some medications that I have been on for years, the insurance companies won't cover it. This is where you talk about pre-authorization, and other things. Paul added, I'm on insulin, so I usually check my sugar and blood level to see how high it is. So sometimes when it is high, then I may take some insulin to bring it down into a range I want it to be. I am using Novolog 7030. And then for diabetes education, here Rena said, I learned about blood sugar levels. Sometimes it goes high and sometimes it goes low. My last A1C was done about 2 months ago and it was 6.4. Latricia explained, the last time I went and checked my A1C was a little bit high. Because my A1C was a little bit high, my doctor said I had to lose some weight. She also advised me to watch what I eat and exercise regularly. Julius also mentioned, my knowledge of diabetes started when I attended diabetes education sections. I have learned that to control or manage diabetes, you must be disciplined. If you are not disciplined with this sickness, you will be very inconsistent in everything you do to maintain diabetes. And for Trayvon, he said, what I learned in diabetes education is that those exercises that will keep your heart rate beating or cardio are the best. I don't focus on my intention on building muscles. So I do exercises that will just keep my heart rate beating. So these are some of the quotes from the participants. As you can see, they are very interesting. And yeah, now for discussions. Team 1 on the discussion where they talk about diabetes complication, participants talk about the effects of diabetes complications. Type 2 diabetes created social limitations for the participants. Because if you have, for those who battle with their eyes, they have diabetic retinopathy, and they cannot see well, they have to use glasses. It creates problem for them because if they don't have the glasses, they cannot read, they cannot do those things that they want to do. And then for diabetic neuropathy, the participant also talk about nerve problems. They think they are tingling, the numbness, and the body pains. Once you have these, you cannot do what you need to do normally on a day-to-day basis. Diabetic neuropathy leads to infection or amputation. That's when it gets worse. So your leg or your hand might be amputated. So it's very, very serious. And then here, as you can see, during the discussion, participant views align with the literature review. So whatever in chapter 2 that we have for the literature, and based on what the participants expressed during the interview, aligns with the literature. Team 2, African American adults with type 2 diabetes acknowledge effective strategies to manage their diabetes. So participants use multifaceted approach to manage their diabetes. So what are some of the strategies that they use? You can see here managing stress. Participants talk about managing stress. Some of them talk about praying. When they are stressed out, they have to pray. Some of them talk about going to take a walk. Some of them talk about they have to calm down. So they give different methods of managing stress. Some of them they also talk about eating in portions, where you don't sit at one sitting and eat a very big meal. Maybe you have a double Whopper from McDonald's, and at the same time you get a big jar of pop. So monitoring blood sugar, carbs counting, regular physical activity, avoiding sugary foods and drinks, regular checkups, and healthy eating are some of the effective strategies the participants talk about. And so people who do not engage, there was this one from the literature that's very important from the Center of Disease Control and Prevention. It says people who do not engage in regular physical activities are at an increased risk for developing type 2 diabetes. So if you are in your late adulthood and you are not exercising, you are at risk for developing type 2 diabetes according to the Center for Disease Control and Prevention. Healthcare professionals also stated that for the body to use its insulin effectively, people with type 2 diabetes must exercise regularly, according to the American Heart Association. So here, several participants revealed that regular exercise or physical activity like walking helps control blood sugar. So on the discussion. For team 3, where they talk about the level of adherence to providers' advice, we have focused participants' interaction with providers. This is just about what participants are saying about their providers. So diabetes education has a positive outcome according to the Center for Disease Control and Prevention in 2019. And Clip Linker and Braza stated that people with type 2 diabetes who follow their doctor instructions by attending required diabetes education sections tend to benefit tremendously. So as you can see, following your doctor instructions here and what participants said aligns with literature because we have it right there. By attending diabetes education sections, exercising, keeping appointments, and taking medications regularly, participants were able to manage their diabetes. Team 4 talks about the warning signs of blood sugar. The focus here was experiences of African American adults with high and low blood sugar symptoms, drinking more water often, urinating frequently, blurred vision, excessive hunger, rapid heartbeat were all reported as symptoms of hypoglycemia. Nervousness, shakiness, dizziness, lightheadedness, and feeling sleepy are signs and symptoms of low blood sugar according to Mayo Clinic. And as you can see up there too, the Mayo Clinic also talk about the symptoms of diabetes. This also aligns with what participants say with literature. Learning and recognizing the warning signs of high and low blood sugars allow participants to seek medical advice quickly. So if participants are aware of their warning signs based on what they learn in diabetes education, when they are feeding